Hi guys, I'm Dr. Adarsh Annapareddy. I'm a joint replacement and orthopedic surgeon at Sunshine Hospitals. I specialize in total knee, partial knee and total hip replacement surgeries. Today I'll be speaking about the total hip replacement surgery. So the hip is a ball and socket joint. Unlike the knee joint, which is a hinge joint, the hip is a ball and socket joint. It's a socket and a ball and it moves in all the 360 degrees. So if you look at the joint in this model over here, so it consists of two parts, the femur which has the ball and the acetabulum which has the cup, the socket. So the movements of the joint are usually very free and mobile. So but inside, if you see this blue smooth thing, this is known as the cartilage, and this also wears out, just like if you've seen my total knee replacement videos. The cartilage here also does wear out and leads to arthritis, which requires a procedure which is a total hip replacement. So once the hip joint comes into this particular state where the cartilage starts to wear out, that's when we can consider a total hip replacement surgery. So what we're replacing exactly is the ball is replaced over here, this is the ball, and the cup is also replaced. That's why it's a total hip replacement. Both the sides are replaced. So that's a total hip replacement surgery, and the movement becomes free again and smooth without any pain. So who requires a hip replacement surgery? Any patient or any person who starts getting pain in the hip joint near the groin region, whether it's while walking or while just even while sitting, that means they may have some condition inside the hip. The wear of the joint may have started. So when do people get this kind of problems? So there are many different reasons for the wear out of the hip to happen. One can be just by age related process, like in the knee arthritis, but it's much rarer in India, irregular arthritis of the hip. Patients who have rheumatoid arthritis, their first joint to be affected is usually the hip joint. And patients who have had a previous hip fracture, they may end up in a hip arthritis like this, needing a hip replacement surgery. So when do we say not to do a total hip replacement surgery? So if the arthritis of the joint has not progressed to such a state that it's causing restriction in the daily activities, medicines and physiotherapy do help. So you may not require a hip replacement surgery at that stage. But once it's been confirmed that you have reached the stage where a surgery is required, you may ask whether patients who are obese or patients who are very old or even very young can get this surgery done. The answer to the question is yes, even an obese patient can get a total hip replacement done. There's no contraindication there. And if you talk about the extremes of age, younger patients who have rheumatoid arthritis, their joints can get completely destroyed and they do require a hip replacement surgery. So even as young as 20 to 25 can get the surgery done. And older patients, even up to the age of 90 to 95 plus, they can get the total hip replacement surgery done as well. Especially the 90 or 80 plus patients, they usually have trivial falls and may fracture the hip joint. So they can get a hip replacement surgery done. The total hip replacement surgery is quite a safe surgery. It has even less complications than a total knee replacement. But there are a few complications which can occur. One is an infection of the joint. Unfortunately, no matter what precautions the doctor or the surgeon takes, there is always a 1% chance that a joint may be infected. The good thing is antibiotics and revision surgeries of cleaning out the joint can help to reduce that infection. So one other complication is known as a dislocation of the joint. So once the surgery is done, we have a new femoral head and a new acetabulum. If the patient is not careful, or if they try to squat or do something like cross-legged sitting and all that, there is a rare chance of the hip getting dislocated. The ball may come out of the cup like this. So then they may have to get a revision surgery to get the ball back into the cup. That's a rare situation. If the patient takes some precautions, then he can avoid these particular complications. One dreaded complication for any knee or hip replacement surgery is the formation of blood clots. So when the patient is immobile after a surgery, in the olden days, a patient after getting an operation done, he had to be bedridden for at least 10 days to 2 weeks. And what happens is the blood flow becomes slower and slower and clots form in the vessels. This may get dislodged and go into the heart. Now, this used to be a little more common in the olden days when the patient was kept in bed for a long time post-surgery. But nowadays, immediately after the surgery, from the next day itself, we do make the patient walk. So this problem of sluggish blood flow and the circulation reducing has kind of been eradicated, and the incidence of blood clots happening has reduced to quite an extent. So we just spoke about the total hip replacement, how it's done, and for whom all it should be done. In the next video, we'll be speaking about the post-operative care, or how to take care of your hip joint after you have the hip replacement surgery done. So please do stay tuned.